Welcome to Lab Guide, your go-to channel for everything laboratory. Here, we break down complex lab techniques, share practical tips, and explore the science behind histopathology, microbiology, biochemistry, and more. Today, we're diving deep into an important, yet often overlooked topic in histopathology, slide mounting. Now, you might be wondering, why should we care about something as simple as mounting a slide? Well, the truth is, this single step can make or break the clarity, preservation, and even the digital compatibility of tissue samples under the microscope. So in this video, we're going to explore the advanced guide to slide mounting in histopathology, covering types of mounting media, step-by-step protocols, troubleshooting tips, and even the future of this fascinating field. Slide mounting isn't just about putting a cover slip over tissue, it's about protecting history at a microscopic level. Each tissue section represents crucial information about a patient's health, a scientific discovery, or even a potential cure. That's why the choice of mounting medium and technique is critical. The right method ensures crystal clear optics, long-lasting stain preservation, and smooth compatibility with automated scanners for digital pathology. Now, let's talk about the different kinds of mounting media, because not all are created equal. We have three main categories: aqueous mounting media, resin-based non-aqueous media, and specialty media. Aqueous mounting media, these are commonly used for water-soluble stains and temporary mounts. A classic example is glycerin jelly, perfect for frozen sections or immunofluorescence. Then we have synthetic options like Ferramount or Aquamount, which don't require dehydration and work well for H&E or special stains. But here's the catch: aqueous mounts can dry out over time, so they're not the best for long-term storage. Resin-based non-aqueous media. This is where we find the superstar, DPX. It's quick-drying, crystal clear, and widely used in histopathology labs around the world. Other options include Entellin and Ukit, which are fast polymerizing. And while natural resins like Canada balsam were once the gold standard, they've largely been phased out because they yellow with age and can damage stains. Specialty mounting media. Now here's where it gets interesting. For fluorescence microscopy, we have anti-fade agents like Prolonged Diamond or VectaShield, which protect against photobleaching. And with eco-friendly science on the rise, new xylene-free mountants are gaining popularity, safer for lab professionals and kinder to the environment. So how do we actually mount a slide the right way? Let's break it down. Pre-mounting optimization. Dehydrate your tissue properly, usually with an ethanol series. Use clearing agents like xylene or safer alternatives like HistoClear. Mounting techniques. Apply about 10 to 20 microliters of medium. Place the cover slip at a 45-degree angle to minimize bubbles. If bubbles sneak in, don't panic, just guide them out gently with a needle. In high-throughput labs, automated robotic mounters ensure precision and consistency. Think of them as the Tesla of pathology labs. Post-mounting storage, air dry or oven dry depending on the medium. Clean up excess medium carefully. Store slides in dark, moisture-free conditions to prevent fading. Even experts face challenges. Here are some quick fixes. Bubbles, lower the cover slip slowly or nudge them out. Crystallization, use fresh, filtered medium. Tissue fading, avoid acidic resins and keep slides in the dark. Cover slip detachment, use enough medium and allow proper drying. Let's talk about special applications. Slide mounting isn't one size fits all. For IHC, aqueous media are great. For fluorescence, anti-fade agents are essential. For digital pathology, bubble-free slides are critical. And in frozen sections or emergency intraoperative consultations, glycerin-based temporary mounts are lifesavers. Future of slide mounting. The field is evolving rapidly. Imagine UV curable mountants that dry instantly, nanoparticle-enhanced media that improve optical clarity, and biodegradable mountants that are eco-friendly. The future is not just about preserving tissue, it's about making the process safer, faster, and greener. To wrap things up, here are the golden rules. For routine H&E, use DPX. For fluorescence, use Prolonged Diamond. For archival storage, go for neutral pH and UV-resistant media. So the next time you look at a perfectly mounted histology slide, remember, it's not just glass, resin, or glycerin. It's a carefully preserved story under the microscope. Slide mounting may be the final step in tissue preparation, but it's also the first step in unlocking answers to life's most complex questions. Thanks for watching. If you found this guide useful, don't forget to hit the like button, share it with your colleagues, and subscribe for more deep dives into the science behind the lab. Stay curious, and I'll see you in the next video.